diving into the fentanyl crisis, you've been very outspoken about this. I think you explained it tremendously during the debate about the ways we can turn around and make our area of Seattle here a beautiful, safe, clean environment where tourists are excited about coming to. There's no reason why Third and Pine should be famous for destruction, and death, and stabbings and violence is terrible. So I've been working in the Seattle area for quite some time, and the fentanyl crisis is personally attached to every single day of me working. I've personally administered Narcan to a 14, like maybe 14 to 16-year-old little girl. The next week I saw her getting high again, just after I saved her life from OD, and she was completely purple. It seems like our leadership has really given up on the opioid crisis here and threw in the towel and just said, oh, well, it's out of my hands. Guess all my policies didn't work. But they haven't actually repealed any of those acts. People have been screaming loud and clear in the city council meetings everywhere. What solutions do you think we can take as Washingtonians, and as you being our unit senators, what do you think we can do, and how do you see the future of the opioid epidemic going for us?
Well, as you said, it is disheartening. We're losing a human being every 4 minutes and 40 seconds in this country. I see it in the emergency department. I get 2 to 5 overdoses a day. And my wife and I almost lost our oldest to fentanyl. So it's very dear to me. And that is why we walked 185 miles to raise awareness to this horrible killer, which is the worst killer I've seen in 26 years in emergency medicine. And it is so because now you could be strung out on fentanyl for $5 a day. Where cocaine was 200, with heroin was 100. And you're playing roulette because there is no quality assurance in these labs, making sure that each tablet is 25 micrograms. You could have 2 milligrams and kill you immediately. And what you do is stop breathing. So, as a scientist, I would like to bring that science mind into politics, meaning let's do things that are effective. Let's stop doing things that are ineffective, and let's find true solutions. And according to results back in 2001, the country of Portugal had a big opioid epidemic. What did the government do? They came in and they said, we can't lose our country. So they passed laws getting drug dealers into prison. And if you were an addict, you had one choice: mandatory rehab. And they cleaned Portugal within 2 years. Okay, that is something that now, when you read about it, when you study it, you said, that was effective. We have been effective spending $430 billion over the last 10 years in drug addiction, where only 6% of it has been preventive measures, prevention of, education of. That has to be more important, first of all. And second, we have to have a firm solution to getting these drugs off our street. This is not compassionate, what we have right now, knowing that people are going to die, and we're basically helping them do it. That is government-approved hospice, in my mind. What we have to do is get those drug dealers in jail and have the addicts go to rehab as a medical emergency, as it should be, have the medical profession take care of these people with this horrible disease in a comprehensive program that includes mental health, that includes drug addiction, that includes counseling, and that includes relationships with businesses and tech colleges and universities that would want to take these graduates and bring them back into society. And that is what I promise as your next U.S. Senator, to pass the Americans Against Fentanyl Act, which will be a law by the federal government, instituted in every state by the U.S. Attorney's Office, and give more power to law enforcement to be able to enforce these laws, get our dealers back into prison, be harsh on the supply. We need, as a government, to be harsh on the supply, no matter if it's coming from another country. We need to put sanctions on that country. If it's coming through our border, we need to have more discipline and leadership at our border so it doesn't happen, and we need to clean our streets of these dealers. Then we could open our hearts and minds into the addiction world and said, we're going to give you a comprehensive rehabilitation program that really works, because 28 days is not enough for our brain to stop controlling us when we're an addict. Our brain is telling us to lie, cheat, and steal to get that next fix, or we are going to die. And they truly believe this. And for us to get them out of that setting, detox for a month or two, and then into a true rehab program where they see that they could be a member of society again and work and have a regular life and have a family and not have to be dependent on that drug to pull them out of life, and find the why they are doing that drug takes time. So that is my solution for it. I think, according to results, it was effective in Portugal. I think that we could certainly try it here and see how it goes. It will be certainly better than health, harm reduction as we're dealing with now, which I think is a step in the right direction, but really not a destination. Okay. Giving a person a low barrier housing and giving them a welcome package of needles and a bong and aluminum foil to do their drugs, and Narcan, which I fully support out there in the streets to save lives, is a step in the right direction, not the solution. Because if that's the solution, then this government approved hospice.
I definitely agree with you, and thank you for touching on a personal note about talking about your oldest. I'm so thankful that they're still with you. I know that it's personally touched a lot of people in my high school, people I went to school with. I'm seeing them on the streets, and I'm only 31. It's hard for me because I see them one week and then the next week they're gone, and I already know where they've gone to. They're
Mhm.
not going to come back from that place, and it's terrible.